In today's Daily Health, it is Black Maternal Health Week, a time to raise awareness about the disparities in maternal health outcomes for Black women across the U.S.
It's an issue we've talked about a lot on this show. And despite overall U.S. maternal mortality rates falling below pre-pandemic levels, Black women are still 3.5 times more likely to die from a pregnancy-related cause than white women. Joining us now is Dr. Bayo Curry Winchell. She's a family medicine physician and health equity advocate. Thank you for being with us. So this is something that is preventable. So why are the rates so bad?
Exactly, like you said, it's preventable. But when we look at systemic racism, gaps in care, and implicit bias, all of those factors contribute to this poor outcome that we see every year.
You've been on the show before, and you've recommended that patients advocate for themselves, speak up for themselves, which sometimes is like harder than you might think, right? When you're sitting in a doctor's office. You've come up with something called the 3 C's. What are the 3 C's?
Exactly. Just like you mentioned, you go to the doctor and all of a sudden you feel anxious, intimidated. And you're like, I came in here to say a couple of things and now it's vanished. Well, what you can do is start by being clear about your symptoms. Instead of thinking, I haven't felt well, instead saying, I have stomach pain, it's been impacting me for 3 days, and I'm not able to eat. That helps your doctor really provide a full spectrum to help that patient. The second thing is being concise. All of us have experienced the 15-minute dread. You might get lucky and get an extra 5 minutes. So lead with the most pressing questions that are concerning to you. And then last but not least, be confident that you know your body best. And so when you lead with those 3 C's, it allows you to feel empowered and get the best care out of that visit.
And you could bring a note, too. I sometimes write things down.
Yes, that's so good. And, you know, it's not just Black moms, it's also the babies, right? And we know Black mothers face a significantly higher risk of stillbirth also than their white counterparts. There's a new awareness campaign around that with a new film. It's called Stillness is an Illness. So first I want us to just watch a piece of that and then we'll talk on the other side.
Okay.
I'm not sure if something bad is happening or not, but I'm not feeling movement anymore.
A lot of babies slow down at the end. It's not much space for them to move around anymore.
I will have the doctor call you.
Okay.
So this film is chilling because it goes through scenarios where the woman is listened to and then where she's not. And you see those different outcomes. So what is your message to Black women who are expecting and maybe nervous?
My message is go with your gut. You know when you don't feel well. And as a physician who went through something similar and almost lost her life, keep asking for more questions. If it doesn't feel right, speak up and ask for somebody else to give you clarity. And if you haven't received those answers, continue to go. Because in the end, it's your life and it's your baby's life, and you have the right to get the best care.
You went through something similar. I don't know if you want to talk about it at all, but what lessons can you impart to people from what you yourself have been through?
My lesson is knowing yourself best when it comes to care. And so as a medical director, I almost lost my life giving birth. But I knew when the nurse was saying, no, Bayo, everything's fine. She wasn't having necessarily being ill, like,
it wasn't malicious.
Malicious, but she couldn't see that I look like something as far as pain. And so for any Black woman out there, hearing my story, seeing that I almost passed away, and the hospital I'm a medical director at, I had to use my 3 C's to advocate. And that's why I'm here to share in hopes that I can help as many women as possible.
And it's chilling to hear that happened to you, despite your role,
right.
The work you do
as a doctor.
Day.
That is correct. And when people hear that, they're like, oh, wow, this can happen to anyone. And I was nearly a part of that statistic that you see. So if you lean into what you can do, which is being clear, concise, and confident, that is a way to hopefully help advocate for the best care possible.
Dr. Bayo Curry Winchell, you are always clear, concise, confident, and I'm sure your work is saving lives even today. Thank you so much.
Thank you so much for sharing all that. There is much more news ahead.
You are watching NBC News Daily.